everyone who is with us today, this morning, who supports the changes for the better in the healthcare system. We welcome our Ukrainian NGOs, our workers, for our international partners, for whom this event is for, to discuss the changes which they are ready to implement. Dear colleagues, we have some changes in the agenda. The point is that Masinayem is an acting combatant, and there was an order for him to early in the morning at 4. We won't be able to engage him in online format. He is in the location which we cannot disclose. So there are some changes in the agenda for this very slot, where we expected Masi presentation on rehabilitation. So we prepared another plan. We'll start with the assessment and some reflections. This was initially planned for the day of yesterday, but the agenda was really intense. So this, so again, we were flexible. So today we'll start our morning with the assessment, and I would like to have a QR code on the screen, and the idea is to consider. We would like to get your opinion on the engagement, on what your association of the future of the healthcare service in the year 2530. There are options: digitalization and telemedicine, automation, artificial intelligence, the new healthcare education in the future, partnership, or your option of the response, or your option. So, we want to know your opinion, your association of the future for the period 2530 of the health care in Ukraine. Everyone can download that. Does it work? Thank you. So we'll be able to see the responses now. We'll have 3 waves of voting. Again, there'll be 2 more questions, and then with our partners, with our culture, with the РАЗОМ Foundation, we'll have an interactive discussion. So, okay, with the first question, let's move on. The second question, your opinion, who should push assistance in the development of the healthcare? The government and the Ministry of Healthcare, international organizations like USAID, World Health Organization, Ukrainian NGOs and other funds, business, investors, international healthcare community, or the patients as the driving force? The next QR code, let's vote for. So, great. You have the opportunity to vote for the second questions. Who should assist in the development of Ukrainian healthcare system? And the next, your role in the future architecture of the healthcare service in Ukraine. The reformer, the leader of the changes, the expert in the implementation of innovation, practitioner, the mentor for the new generation, or administrator with us, or the partner in the development of the ecosystem with other stakeholders. So we have 3 questions. We want to get your opinion. We want to see it on the screen. Would everyone manage to proceed? Everything is okay technically? Yeah, technically it happened. Great. We can put the results on the screen. those who are online, dear colleagues, you can participate in this assessment as well. Can we put the answers on the screen? Everyone has voted. Everyone managed. So, no technical problems. Great. Dear team, can we see that on the screen? One minute. So, first, it was important actually that you participated in this collegial assessment to see 50, 60 people here in this room get your opinion about the ongoing changes, your role in those changes. It was important for us that among the core core thinkers will be able to discuss that. I'm waiting for the results of the voting of this, and I would like to invite the partners who basically run this discussion with you, who would ask for your reflections, discuss what issues through the answers, which we'll see Evelina Koreles, Lea Jaluki, and Vitaly Svichinsky are the moderators for our hot discussion. First, good morning. And everyone enjoyed the coffee, but whether everyone woke up, let's check. The second point, I know that when you participate in the panel discussions or in the discussion, the time is limited. When you have 5 to 8 minutes to speak about the real problems is a challenge. Now we'll have the chance to discuss very hot issues. For example, we may talk about unfair coverage for location of cadre demobilization. We may talk about the need or why some hospitals should stay in certain region. So any challenges which have not been discussed yet. But in order to have an interesting transfer that have great moderators with us today, I suggest to have a look at the responses. I hope they were okay. Let's start with hot points. My hot point, I more interesting. My husband is a surgeon who spends lots of money for cover lab, and this is something I would like to explore. Licensing for foreign doctors in Ukraine, how we should be responsible, like a Ukrainian doctor who invites a foreign colleague, whether it's fair or correct, though it's useful. I'm sure that you have lots of other issues you would like to discuss. Anyone wants to take a microphone and say, oh, hurrah! Good morning, dear colleagues. I would speak not about my concerns, but from our staff, from Укрзалізниця. There are two issues. The first, the WorkComSec, which refers to our staff, the combatants, the ex-combatants, and SEC is not perfect. There should be a reform. Everyone agrees. Individual rehabilitation plan, it's not there yet. And there is one point. We met this in different light work from home. Light work. This work from home, this is a challenge for many of our staff because we with the first group of disability, we employed the staff in the office. That was more of the office profession, and the person was able to. But for the second group of disability, same light work only at home. In Lezova and Kharkiv, we were not able to find a job, and he would not be able to find such a light job in the region. So we have the professions which are not compatible at the country. So either on the Укрзалізниця or nothing. This second, the commissions, the hazard conditions, safety rules, we have to go through the medical commissions periodical review. Permanent medical review, the list of professions which require. In the regions, many hospitals stop providing the service of medical review. We pay for that. We are ready to pay for that. There's a need, but there when we look into the substance, why our staff goes to the big cities, spending time to get this medical observations. Unfortunately, small hospitals there are no specialists who maybe compose the team, like neurologists or other specialities, which should be part of this observation team. Thus, we look that the vicious circle, and very the technical approach, the big number. I understand that the protocol is important. We should stick to the protocol. But considering the situation, many doctors don't consider individual specific and follow protocol only. This is a global issue, but you asked for to articulate the challenges. Let's give a round of applause for Укрзалізниця for what they did, how many people they evacuated, and the evacuation still continues thanks to you, and thank you for the first aid kits. My concern is I'm a director of small hospital in a rural area, and yesterday it was really painful for me to hear that big, strong, when the representative of the big hospital spoke that the hospital like us should not exist, should not develop, but rural population has a right to good quality healthcare services, availability of the services, and the access in the rural area is definitely lower. The villages might be 40, 50 kilometers away with no roads, and those who still in the birth rate goes down, but the elderly people still stay. The IDPs are coming, and they need healthcare services. They need. My point is, let's put it that way. I have a great hope that the national service started to talk about such a format as the clinic for the community. First and the second line being split, and so small communities, small hospital are overloaded considering the admin expenses. But if we're united, we would be able to provide better quality service, more comprehensive service. Not be that strong, but for the rural population, that kind of services provided 24/7. Well, yeah, we do have observations, welcome, but we are not part of a strong network because of the density of the population, 30,000 only. We're not part of this strong network, but people do live far, and they also need medical services. Dear friends, Evelina would like to take a microphone for a minute. rural medicine. I had some experience with the head of the Rayon administration. In Odessa was Mikhailis, in Georgia, Saakashvili was the governor of Odessa region. My personal case, we experienced the same problem as you described with the hospital of the second level. Horrible, horror services. The first thing I did, being in the position of the head of Rayon administration, I closed two departments, maternity and surgery, meetings, strikes. Then I didn't realize how serious the problem is in the heads of people. The closing two departments for them was a disaster of closing Rayon, the opportunities to get the services in other hospitals because 20, 30 kilometers for them was the distance like to fly to the US. I had to talk to people, 2 hours non-stop speeches. And by the way, what's important, there was no healthcare reform. There were transfer and only just high temps of Rambuliana Suprun who started to make interactions and to close those two departments at that time. No alternative. We found the alternative. We signed contracts with the hospital in the cities close with better quality and transfers some of the transfer to surgery and the deliveries to those who, moreover, we forced them to report. And finally, when people started to get there, that our patients started to get better quality services because there was an understanding that that would be payment for that. And then I focused on the national line. I started to do everything possible, the diagnostics, telemedicine, the patients from small villages would have access to highly specialized assistance, so diagnostics and from telemedicine was a solution. My point is that not the rural ratio, and we had a chat with Sergey, not other admin methods from the national. So this is a management decision. You should, from strategic perspective, understand what's this reform about, and then implement on site all this what we discussed. To us, the government, to find a solution for us, no one will do that instead of you. And first of all, what's important obstacle, local, regional politicians, and people who don't want to understand that they should get a better quality service and should the sufficient get there.
Передаю далі.
Good morning, everyone. First of all, let me provide my own feedback. So yesterday we talked about the highly specialized healthcare facilities, and at first, and then I would like to provide a case from my own life. We in Nadvernansky district, we have so-called site of power. And when you start rising through the districts, you can calculate the number of clinics. So, and plus the community is not poor. And but people complain constantly of the quality of water, of the quality of infrastructure. But so what I can say, not everyone in Ukraine can have this private vehicle. So what I want to say, well, would be much less expensive to create a big, good, well-located, specialized clinic and then to provide for the transfer to this clinic for the local population. It would be much more expensive than to keep several clinics at a time. Well, sorry, there is a comment, but the microphone is not used, so the interpreter cannot hear. Okay, let me tell you. So I have a grandma who lives high up in the mountains. I understand what Alexander is saying, and I see what you want to say. So we try to find the most effective solution. Okay, in case we have a clinic that needed to be equipped to be staffed well, and plus the transfer and so on and so forth, will it be worth doing it? Again, in every single case, there is a complex of solutions that should be analyzed, and the relevant decision should be taken. Again, let me tell about communications, namely communication as the skill of really transfer your own opinion. So we have also to use the communication within this audience as well as to use the proper communication in between the facilities and the government agencies. So, because sometimes we cannot find or cannot see the needed solutions. Plus, for example, if we see a manager, or if we consider a manager living in a specific district, knowing about all the whereabouts in his district and what should be done. So one has to translate. I mean, to communicate well. And again, same goes about the primary facility owner and the local government. So every time when we talk to MOH through some specific platform, we also miss some communication. So someone didn't supply the needed judgment, the needed explanation, so the other cannot hear. So again, what I call upon to use the communication skill to develop and use them, since we missed it a lot for taking the needed decisions. Igor Kiyashka, Odessa, urgent medical aid or emergency hospital. Yes. Well, again, basing on my own experience, what I can say, before my current position, I headed a clinic in Selidovo town, which is now occupied. And so I decided to provide my own opinion now within this discussion. Okay, relocated clinic. It's a very good resource that we have to use to save the health of our civilians and militaries. So where is the problem? We in Selidovo, before the occupation, until we were occupied, we tried to provide every single service. We're secondary line facility, so we provided all the needed services, plus deliveries and so on. When we understood that we will be soon occupied, So, together with the local government and international donors, we try to save the equipment and the stuff. So, thanks to local government, we identified the location in Mykolaiivka village where there's a good premise, but no equipment over there. Again, the advantage of the site was that there were no need to refurbishment, and we just relocated our equipment of a cost of 100 million of hryvnia. So, but no, with non single program, I mean governmental program or local program, resolves the issues of the relocated clinics. And the relocated clinics are very powerful resources. When you start talking about some small clinics and rural clinics, so it's economic component. I mean, the need to purchase equipment and so on. But we already have this equipment. It's, I say, our cost was 100 million hryvnia. So we equipped, installed, and accommodated everything by ourselves with our own enthusiasm, with the aid of the charity organizations, the local governments. We are ready to work, but none of the systemic programs provides for that. I mean, from the state. That's why I wish to express a message to resolve within the system the issues of the relegated clinics. Okay, Vitaly Koshkina. I have a reputation of an unpleasant person goes ahead of mine. That's why I will start to talk about the unpleasant things. We don't like to talk about that we are a poor country and we have to use our resources as effectively as possible. We are a country in demographic crisis, and this crisis will be even worse since the population will be aging, will be getting more elderly people, more diseased people. We will have lots of veterans, disabled with the complex conditions. That's why we have to consider all the dialogue within the focus of a poor country with a lack of finances. And that's why we have to raise up our efficiency, not quantity, not something else, but the efficient use of money. That's the first point. The second point, we have to talk about the education of our medical specialists, since our medical education stays on the lowest possible level. Until we get good education, medical education, we will not be able to get good stuff. Plus, palliative aid. We have to develop palliative aid, considering we will have even more diseased persons, more elderly persons, but this should be qualitative palliative aid since it's medical service. Since all the games with humanitarian assistance and reform, these are the gains, just the gains. After the reform has been launched, the situation started to get worse, and everyone should work into turning this reform into positive way. Okay, I changed my mind, so I will give one more microphone. I really liked very much the communication. Communication is a real problem on every single level, and our discussion also shows that we have the communication problem. I mean, everyone lives its own bulb in its open, let's say, box, and everyone tells about his own problems, not listening to another. And everyone knows how to do it well. Okay, then we start doing it, but no one comes to do the real things. And plus, I don't know why we split civil medicine and military medicine, and that a very simple request for the antibiotics. And when I say that all these medicines, Pablo medicines, they don't work, but the volunteers say, you don't know. It really works at the front line. We know it better. And then I'm talking a lot to chief doctors. Okay, you vaccinated your guys, but why? So hepatitis B, tetanus, why? No, why? Why should I inject them some Indian shit to my guys?
Cases when the combatants were prescribed the medicines which were not proven, we tried to interfere in the 100 medicines were on the list of the Ministry of Defense, and it was a hard time for to delete that list. Great. We move on. Natalia should get a microphone. Natalia Liska, charitable fund. For medicine. I have a personal pain on another medicine. We do want to add it to the precursor list. It should not be easily available in the pharmacy. We realized the second month of the war back in 2014, the situation was a disaster one. And yesterday the colleagues mentioned the by this medicine themselves get orders from the when I see the request, and there was even yesterday a request from Elizine, Cerebralizine, Neobiphine, and other medicines. This is one case on those meds. And there are two more pains, special meals, and the colleagues okay, respiratory support. Thank you. On respiratory support, we did a big advocacy campaign campaign in the country on respiratory support. We invited everyone, targeted patient organization, big funds, government institutions. So Dubro was not here, but Katerina should excuse. We expected Deputy Minister withdraw. Point is that overall, this period, so the whole year, we ran this advocacy campaign. And finally, we were able, the document was signed with respect to the order of the ministry to create a task force on the development of the protocols. And again, we don't have the ministry with us. And we got stuck. We got stuck in the long process. I would like to ask all of you for your support. Maybe you'll continue communication. I do understand that we are already there. It's not a popular subject. No one is willing to deal with this subject. With a great number of international organizations who support big institutional things, but very narrow subject, very few is ready to support. I'll send lots of letters to our partners. Let's think about those patients. The respiratory support, we're adopting the project to breathe. So who is, same partner, same partner. So you are welcome to approach us. I would like to thank the colleagues. The logic is that the big problem is not only that the patients are not getting sufficient the support at home, some special equipment, or either at home or at the institution, a healthcare institute. The logic is emergency departments have it, but we should not proper solution that most of the doctors, especially from the polyclinic, they have no idea of the specific medicine, Chevelle, CPAP, and that leads to serious consequences for the patient. They have their own ideas about treatment without good quality protocol. There are protocols which respiratory support is mentioned of COVID, but it's not a comprehensive treatment. We should find solution, and I would like to thank our organizations. It's not a popular subject. They're a stereotype. Palliative is not about the death, but about the life. It's important, but this is an advocacy campaign about the smiles. I have a lot to say, of course, but let me be quick. This is a successful case which confirmed that the respiratory case can the atrophy, back atrophy. This was the subject which we discussed throughout the country, and we managed to find a solution. Early screening now allows to identify the decision. We managed to procure medicines, and now the kids which get with the plant from the birth, they don't demonstrate symptoms, so they have the chance to live normal life. And we did this because of a broad campaign. This was a success case. Well, and respiratory cases does not differ much from the other one. So in the initiatives, your initiatives, and so this is the only chance for me to keep a microphone, but on education, medical education, piece by piece, deep very poor management in the hospitals, and this is where we have problems in the healthcare reform. There's no good managers. The manager should grow up within the system. We should find good quality management, not to especially in the regions, not to expand the pool of good managers, and we invest into that. We pay for the scholarship in Mogilyanka Academy. Irina Koshkina, who studies there, and this is the scholarship we pay, and we have Pavlo with us. We have mini MBA courses with the National Healthcare Care. This is for the management teams in the hospital. We have to invest, and we ask all the donors that this is where it should start, from the decision makers at the level of the hospital who manage the process. So this is where we should start investing. Thank you very much for your attention. There'll be another. I thought that we change the format, a dialogue and the panel dialogue and the panel some exercises. Hello, Metro Push, UNDP in Ukraine. My reflection would be on the management. Great comments. A lot depends on this. I work in the healthcare, so especially in the community level. Another comment from me, self-governance, adequate self-governance, because that brings the point of education and the point prescription of the fake medicines and how the mistakes may happen, the mistake from the doctor, and whether they are entitled for that. And the point in Ukraine, which may unite education, especially postgraduate education, and respectfully following the protocols, the advocacy in this society, the doctors. Thank you. Hello, Stepanova Irina, head of the Public Council and Donetsk Oblast Administration. 6 or 7 years worked in the regional advocacy in Donetsk, Lugansk region, and when I've heard advocacy, my favorite word, I would like to support Igor Kiyashka and the hospitals from Lugansk that relocated hospitals desperately need special attention and strong support. I was engaged to some extent to the relocation processes. These are great people, great ADP. If we would be able together to help them, may have different resources, but that would be great, and we do a great thing as we use keep the IDPs as not a burden for the accepting communities. This is a resource for those communities. just regularly highly qualified specialists, maybe ADPs. My next point is about now we have different representatives, civil society, and the charitable fund, NGOs. I would like to ask you for a favor. Please engage representatives, public councils from those regions who suffer from the aggression to your events. Please engage. We have some competences. We may be useful for you in your advocacy campaigns. And the head of the council to join our oldest council. Lots of representatives of the healthcare community. We have only two people in our, so myself and Yuba, because our doctors went to the battlefield, the members of the civil council. Let's cooperate, let's be friends, and please engage us to your advocacy campaigns. We can write letters for good things which you're doing now. Thank you. Interesting subject brought up, Paulo. And now, Buffin, this is what Paulo, we should be as a society ashamed. So we're just talking about palliative, but basically it does not exist. Only there where we have the leaders. And we should not do palliative departments, but we should observe the quality of the services. When I take a child from the hospital close to 2 year problem with feeding through the zone, we're torturing such child. We're talking about palliative care for many years. We have injured combatants who need good quality services, but I see the trend there's a fashion to open palliative departments. Now it's trendy to do rehabilitation center. Everyone is opening rehabilitation center. Why we not able to finalize palliative care? So we should really finalize this issue. And the civil society now, at this time, at the time of the big war, we have lots of cases with palliative, lots of work ahead of us. At some point, it became not trendy. There were lots of conferences, and there was a big movement. Now it's there, but they're single cases only. I work only not with the injured combatant. I do transportation of difficult cases of children. When I fight children, when someone is sort of taking care. And when I'm taking the child from one institution to another, is well fed by a spoon, and the child is taught to walk after 2 years being in bed. This is really and civil society again, we should advocate for that. We have a lot of injured combatants to put them back to their families. But are we fighting for them? We as a society should support those families. Society, especially the difficult time. On Obufin, those who are using this, those who prescribe that, who sell this, these are the criminals. Let's call them. Why these who use Novocaine, after some time, they go back and they're under stress. They continue to take Novocaine. That refers to volunteers who deliver this message. So I had an evacuation person, a light injury. There was the misuse of the medicine. So the person, I didn't know I applied the medicine. It was a nasal spray. So the application without any control, and we had lots of medicines like this, is a big problem. And this is some palliative care. The family, when there's only one wife or a mom, an elderly mom with her son. So palliative care, those who are doing the advocacy campaign from big NGOs, let's do something about this. The level of palliative care is lower than in Belarus. So the point is that the financial coverage, not only, but the package, there it's not trendy. In the past, the transportation, evacuation, when this, you're looking for palliative care, you make a call. In theory, it's there. Practically, it's not. And this is a crime. And this is a crime against humanity, the case with palliative care. Natalia, I don't have the time for you. Let's be frank. Every hospital was contracted for palliative care, but only very few can cover that. And the money is not spent properly. And very often the hospital where you work for, let's admit, not everyone who has palliative care is able to provide good quality assistances, and they have, first of all, here and here. The money is secondary.
Now we give you the governance. Okay. Now let's see the results of the survey. What is this? This is the last question or which one? So you associate the future of the medicine with which? Digitalization in medicine, robotization and automation, AI in diagnostics, medical education of a new generation, and partnership. Public-private partnership. So, please raise the hands who believes in artificial intelligence, in AI. Okay, we've got almost 50% of those who believe. So I really love those who opted for public-private partnership. Next, who will provide the aid to Ukrainian medicine? So the first option is international organizations. Second, Ukrainian civil organizations in funds, self-recovery, self-aid. Who asked us about So, next question. What is your role in the future architecture of the medicine? So, who's the change leader? So, I see that every leader wants a good partner. So that's why we are together in order to improve and close or identify and close all the gaps. I hope that you like this format of the dialogue that we launched. So we wait for you next year, and I hope that next year we will think over of the same format, but we will expand and change it since I have some issues of a critical importance for me. Thank you. Let's give a round of applause to our moderators, and thank you very much to raise up these acute issues for discussion. And big thanks to you for your voices. Now we get the tags and we see the results of our survey. So I see that a lot of people rely on international aid, but we have to believe in, first of all, in ourselves and rely on ourselves. Now we will launch the next rounds of discussion, and I would like to invite here the panelists, Vitaly Svichinsky, Operation Director of РАЗОМ for Ukraine, Volodymyr Kvashuk, Surveillance Council Chairman, Olga Zamatska, coordinator of the project of Patients of Ukraine, Юлія Наговицина, Director of the programs of the Tablеточки Fund, Victoria Drac, НОВА Ukraine Director, and Pavlo Bogdanuk, co-owner of UHC, WHO consultant. I will moderate this discussion. Okay, please. Technical team. Please find me a chair. Okay, but nevertheless, I can stay in there. So, the first question will be to Yulia Nagovitsina, Tablеточки Fund. Tablеточки Fund is the most successful and long-living project in Ukraine. Yulia, how do you assess the role of your NGO, and namely the NGO sector in supporting Ukraine in the third year of war? And you invest lots of time in development of healthcare professionals. So what is your role? What are your opportunities and capabilities for 2025? Please share with us. Okay. About the public-private partnership, I mean NGO sector and MOH and other agencies, I would mention, first of all, what is really the field where we play. So we decided that we will play in our expertise field, and Victoria Romaniuk yesterday voiced a question that is really relevant for everyone. I mean, the question, whether do we keep our focus as before? Why do we save the deceased persons while the younger wounded patients die? So I think that this is just the crisis point when you just lose belief in what you're doing. And you start thinking that your aid is rather evil than the good. So, and plus the responsibility and professional dignity in the sense that we feel that we didn't resolve the problem within the area we played. So we changed the format of collaboration and cooperation. I think it's I feel already some professional bias when I start protecting and supporting the governmental area. So again, I agree with Pavlo. Notwithstanding me, I represent the private sector, but I work for a long time with the public agencies, so you start to protect the public agencies rather than your sector. Again, we complement the public sector where we see the inertia or lack of resources or some lacks. For example, what we did, we evacuated the cancer diseased children abroad, for example. Within the first days of war, we evacuated 38 children, while the public sector started the evacuation only April 12. So before, just compare before this date, we already evacuated over 500 children. And again, you have to land your priorities. First of all, the priorities of your organization with the priorities of the state policy. So we advocate for centralization of the highly specialized medicine, in particular for rare and orphan diseases that cannot be treated not in district, neither in oblast clinic. So the war just, let's say, put a specific emphasis on that issue. And I'm really very upset when I read that some donor or sponsor invested in pediatric oncology ward in Chernivtsi. It's just an example. Okay, but is this clinic? It's not the referral one. I mean, the central one. Why should you invest in there? So, and again, when international experts say that Ukrainian medical education demonstrated resilience and adaptability, we see here a big problem. And this is true. It should be reformatted quite deeply. The context, the evaluation, and so on. So, what has been improved is just postgraduate studies, since the world now is open to us. So, we already providing for the 5th year the English courses for medical specialists in order to promote the access for the healthcare professionals. So we try to develop hard and soft skills at the medical society. We advocate for advanced medicine in our students. We have 20 young students. They, for example, they studied for a month the Maya statistics, and this is their last day to show their skills that they developed. And biostatistics should be delivered yet in the university, but not by some private organization, since this knowledge is needed to all the doctors. Thank you. Thank you, Julia. I know how much you're doing to develop the medical specialists, and thanks to your assistance, this group really receives the incredible support. Thank you very much. Now, my question to Volodymyr Kvashuk. So, Volodymyr, please say, what is the biggest lack on healthcare facility, and how your Zdorovi organization can help in there? Thank you for your question. First of all, let me express the big appreciation for the real resilience that we see in our real life of all our medical specialists, all the healthcare workers. Yes, first of all, this is somehow the impact of medical reform, and this is really the long-term strategy issue, since none of the countries, none of the people stay in such difficult conditions as we here in Ukraine. And let me forward such a thesis. When we speak about good education, knowledge, and training, say that, how important is it? I would say it should be done yet yesterday. When we talk about, for example, same as when we talk about strategy. So last spring and summer, we joined a project where we provided the assistance to healthcare facilities to develop their strategic plans. And let me show you my own observations. So during the discussion, we really talked we talked really, let's say, randomly, and really few, or I'd say little time to the team of the facility itself. And the team should be a team. And plus, it's much better to develop and make decisions within a team, and also to develop as a team. Then we see the excessive domination of the operative aims over strategic objectives. And here I would like to mention that the modern management model is that, first of all, the managerial competences should be available at every level of the healthcare, let's say, institutions and facilities. And so every facility head should develop it. Then, when you implement the initiatives, it's a cyclic process, and it has the same attributes as our algorithm, and can be compared with when you see a patient, when you, let's say, consult the patient. And yes, there are some plans, but we really see who's responsible or what, and so on. That's why I decided to change our discourse, since we devoted a lot of time to discuss the external challenges, but internal barriers and challenges also need a specific discussion. Why? Because it's also about the maturity of our organization, and concerning where our fund здоров'ї can intervene. So first of all, to help the medical facilities heads to develop their competences. First of all, and what we see, there's no good plan, no good planning, and not every time we can see or we can choose in between the two plans. Sometimes it happens when we have to choose between a bad plan and even worse plan available. But the plan should be developed the way like responding to all the requests within the community. When we see the cases because of the bad efficiency, some clinics or wards have to be closed. Thank you, Volodymyr. Thank you. So in 2025, we will broaden our help and our assistance, through the study courses abroad, and or to introduce the different types of management like biosafety, wash methods, and modern norms and standards. Okay, my question is to Pavlo. Pavlo, please tell us. So many years you are involved in healthcare system reforming. You participated in medical education reforming, also the implementation of a whole variety of educational projects. So what are the challenges you see in this area, and what are the main gaps that exist for a long term in Ukrainian medicine? Nevertheless, we pay a big attention to them.
Natalia, to respond to a question, not the gap, but it's the way it is ignored. There's illusion that there's no gap, that there was an old drawback of the old center that sort of guaranteed everything, but the fact that the hospitals were able to do very few things, and the government ignored the fact and was busy to support the life of the hospital, no matter they were doing for the patient, and they didn't care about the quality. So basically, the reform started for this, the medical guarantees program and national health service started, but we did not cure all disease. Moreover, it infects the new system. Now the program of guarantees words like an nostalgic and promises no one would be satisfied, but this illusion of happiness. The program medical guarantees was established for the patient. Finally, for the first time in many years, got clear and fair response to the question if the services are provided, paid by the states, but for what service it was medicine, what kind of quality, and which hospitals the patient can get for his taxes paying. So what we got in the year 24, it continued. They don't hear the questions. There is a basic services, general surgery, there's a surgery operation in the hospital. There's specification to the service. By the way, it describes a high quality standard. Tells that the patient, in addition to everything, should be secured daily observation, access to tomography, all the medicines according to the national list and standard, and there should be emergency department and intensive therapy care, what the patient gets on practice. From the national service say that last year this 689 hospitals provided the services under this pact. 158 every fifth. The average one or less surgeries per day, 310 every second hospital did two or less surgeries per day. This is from the National Service Center. So my son, can we do two or less surgeries per day and secure everything described in the standard, including reanimation and full package of medicine from a it's nonsense. Whether here that in those 310 institutions have no access to CAT, MRT, or lab 24/7. Do you have any doubts that the patients pay from their pockets for their medicine and the gap is covered by the patients either by their own money or their from their pockets. The national service knows that the services are not provided. Whether those institutions will be contracted next year. Who thinks yes? The hospital lied to the national service, and the national service knows about them, but will sign a contract with them anyway. So national service will lie to the patients who need surgery that their assistance is available at those hospitals. After that, the national service call hotline. Isn't that a cynical statement? For the region hospital, the contract with the national service 315 hryvnias, an average cost for 17 so the national service signed a contract for 18 surgeries a year. There are hundreds of hospitals. So what should we call the hotline for? The idea itself looks like cheating. The main problem that we built the program of guarantees on they found it online or getting to the old consensus. The hospitals pretend that they assist, the government pretends that they pay for the hospital for that, and the patient is in between. Is there a solution? Yes. The program of medical guarantees is a solution, gives the legal opportunity for the government to say which services they cover and which not, what medicines they can provide and which not, which hospitals are able to treat the patients and which are not. But there should be a wish as well and the courage, because one should mention that in the program medical guarantees there are problems that the program is not able to cover everything. Not every hospital can provide good quality service. If we don't articulate the problem, how we would be able to solve them? And the hospitals do everything, but how then we can be helpful to them? Many friends, my friends from international humanitarian organization, whom they think are responsible for the reform. The doctors say that they have everything and everything is under the control. We discuss here interaction with civic sector and healthcare institution. The civic sector has great potential in Ukraine. It will help the government specifically in program guarantees. I mean, they can be service provider, but formally everything is provided. They have no room, so the sector should in parallel fight with the illusion of the control solving the consequences on the level of individual patient. I think this is the biggest problem which has not been solved and remains unsolved in our system. Thank you. Pablo, thank you very much for your openness. We'll get back once we get an open microphone. Now I have a question to the patients, to all our patients of Ukraine NGO. You are the representative, the strongest organization in Ukraine. Because for many years, there are strong voices of society. How you assess the quality and availability of services? Sort of continue Pavlov's statement. Thank you very much for your question. Indeed, this is a subject which continues Pavlov's statement. I have some notes as well from this study from our hotline. Basically speaking about the quality and availability of medical services. If we speak about something good, and there are positive cases, good cases is basically exist that the reform actually started thanks to the beginning of the reform. If we speak that what improves access to good quality assistance to the patients, this is what we got from so, so the link of the patient to the location. So with understanding that the assistance could be of low quality and not available, and as representative of the NGO, or I'm a patient as well. We are the patients at some point in time. I saw how it works, how the hospital was just on the way of the ambulance. It was a father of my close friend. He was brought to Rayon Hospital, which sort of at reanimation department, sort of observation, sort of surgery. So, and I had a case to review the file over 7 days of the state. Reanimatologist did not come because he did not have time, and that was on his file. So the patient was not able to drink or eat. He was at the infection department because he was throwing up. They thought that it's an infection. So he was brought to the infection, and the family found out. So we have lots of. Why do we need that kind of hospital on the route of the ambulance? The next hospital was in 20 minutes drive from that one. This is a very sad case. From the pluses, the patients are not linked to the place of residence. They can search, they can find through a hotline a way to get access to healthcare services. Speaking about this study which referred with cancer, the study was done back in 2020 and in 2023 on program of the guarantees. This is a positive outcome of the reform, by the way. In 2020, the number of patients were 30% but in 23, 61% from those who apply are sure that they were able to get the services. We compare the number of the patients who were able to get the support chemotherapy, 33% and 77% respectively in 20. Sometimes someone may call the hotline from Kiev and get the information about the medicines available in Lviv. So the patient must use that. It's not working properly, but it exists. From positive outcomes of the reform and what been used by the service providers, by the hospitals, which work more efficiently than the others, their independence, their ability to work on their development plans, develop their stuff. In our organization, we have a project. We develop the networks where the successful hospitals share their experience. It's not always an oblast level hospital, but a hospital who understand the place in a small community. We're able to find the services might be useful for the community, and it's not therapy. Oh, one can get 10 days of injections. There's some hospitals which try and the establishment of the network which allows be efficient in uh, the funding. They can, they can there are successful hospitals. This is from the positive about accessibility or good quality services for the patient. And speaking about the informal payments from the study, which we had on our hotline in 2020, 52% patients mentioned that they paid informal in 2029. So the share is shrinking for different reasons. About the minuses and the quality and the availability, 68% of the patients which apply to a hotline have no idea about the program of medical guarantees. Regardless of the awareness campaign, we continue doing so that the patients don't know, and those who should inform the doctors who work on some understand what problem. The doctors pretend that there is no program. They pretend that they assist. That not interesting to do. Maybe they don't know themselves, but on the study which we had the information from the doctor back in 2020, the patients with gotten only 9% of cases. In 23, 25%, still very low. If we speak about the problems with access and the quality, we speak about funding, of course, how to allocate it, and the deficit in funding from the budget. There is a shortage of 40.48 billion hryvnias for the medicines in the budget. What was allocated to the budget 25 covers only 60% of the needs, and innovative medicines and modern treatment of complicated diseases. Currently, for the year 25, they allocated for that part 246 million, which is 13.2 from the need. Access to the medicine. This is a learned negotiation and special procedures pharmaceutical companies. These are special contracts. And the informal payments, I mentioned that in the section of the plus. It's in the pluses and in the minuses as well. What we can do is this. So the patient should be informed, and actually it's one of the big opportunities. acknowledge that it does not exist. We don't have the service. We won't be able to get it there, and they would for the second the patients is a strong driver, and the international partners count on us. They see that people can do and they should fight for their right for good quality service and access to it. Understand that it's not always possible when you're sick and you're scared, but society organizations which protect the rights of the patient, their families, the patients when they're strong, are to call the patient's hotline. Sometimes the hotline from the national service. Not sure. We try to make referrals to local self-governance, which should secure certain things which they promised. That works. Thank you very much for the statistics you shared with us. Indeed, how the priorities are changing the potential for healthcare programs which you supervise in terms of the potential changes support from this.
Враховуючи
Oh, it's rather complex question, namely, considering the results of the last elections. So first of all, RAZOM, for Ukraine, priorities stay the same, and we try to do everything possible for Ukraine to be powerful, independent, and subjects really the self-governing state, and we will try to work with every single structure that supports this idea. Concerning our projects, namely, we will lay down for 2025. We sure continue investing in medical education. Same for managerial teams, where we cooperate with Pavlo and his organization. And we also will invest in so-called sectorial events like conferences and so on, like co-pilot project. This is a joint mission together with American doctors, where we talk about the qualitative services, but not always, not only about them, but qualitative trainings and courses for the Ukrainian doctors. We try to find projects in areas to serve as game changers, to radically change the approaches in some specific areas. It's like the urgent ultrasonic diagnostics. Namely, this project is called upon to change the attitudes of the doctors and medical assistants to ultrasonic examination, and to use it through, on all the lines, like starting from primary healthcare line to the military conditions, and we trained already over we trained a lot of doctors, and we delivered over 500 ultrasonic devices. So we will continue doing it. And so, ultrasonic examination it's like a new stethoscope for the doctor. we have to change the stereotypes of the doctor that keeps always has on him or on her the tablet together with the ultrasonic sensor, but not always a stethoscope in. So we expect to change the format of the medicine, and I believe it will be scalable, and it's about changes. When talking about in general sense, we will support the initiatives that we consider to have maximum impact of the healthcare system. So that's why we try to consider and assess the projects that we receive from our partners, like telemedicine and so on. I believe we will implement such projects as well. And I'm very pleased to have here the heads of the facilities who are the managers of the project. This is really cool. I was astonished to hear that, yes, we have such people in the hospitals. So when you start implementing projects, you start talking same language as we do, and then we have to adapt our activities to the projects ongoing in some clinics, and in particular when we have to employ the local healthcare workers to help us with our projects. And the more of such changes we have, the more donor aid you will be able to get. Thank you, Vitaly. I was rather upset with the results of our survey when over a half of the audience rely on international help, while we have to rely on ourselves. So, Anatoly, we will listen to you. We will do the mic. So, please tell us how NOVA and РАЗОМ consider their priorities. Will these be changed for 2025? What would be your initiatives? Thank you very much to participate in this discussion. I'm very thankful to everyone present here, namely for the opinion voiced. It's really the ideas expressed in line with mine. We get money from US, and unfortunately, the situation is changing. I mean, the less and less money is coming. Unlike the before, when we got millions of dollars, and we had the opportunity to choose any possible equipment. Now we have to think about how to effectively use or spend this money. But I try first of all to cover medical projects. For example, we spent over 55 millions for medical projects. I hope that we will keep up at the same level or even increase for 2025. we rely upon our own expertise. So first of all, saving life, and then to restore the lives. So these are our priorities for Nova Ukraine. And first of all, this is tactic medicine. Unfortunately, the active hostilities are ongoing and will, unfortunately, that's why the tactic medicine will be expanded, plus 20%, I think we will use of the aid. We form the individual kits. We purchase turnkeys and bandages and all other aids. We help stabilization points. We try to equip them with all possible equipment like portable ultrasonic, portable CT, since a lot depends on the first medical aid provided. Then, yes, we drastically lack the public financing for the medical facilities. We did a brainstorm, and so we decide to help where the public aid cannot come. So we provide to clinics the equipment they need. We are thoroughly analyzing the requests from the hospitals. We use the expertise of our partners like Zdorovi and other organizations in order to verify such requests. Yes, there are gaps in metadata since the data is not timely updated. Again, we try to do it quite thoroughly. And also, the topic of nalbuphines was discussed by. I haven't heard here the issue of the pain, chronic as well as acute. We have our own project, medicine of pain, and in the third quarter, we launched a center of medicine of pain. We know that the analgesics in drugs use increased. Why? Because the problem of pain persists. Lots of military and civilians suffer because of pain, is traumatic amputations and wrong surgical interventions, phantom pain. So the problem is quite relevant and will increase since we have, unfortunately, the frontline shelling is still present and will be. And that's why, together with MH, we launched this center. The first center, expert center, a basic center, was opened in Feofania Clinic. Stroka and Dmitry Dmitriev and other experts were involved. And this project that started in 2024 is almost completed. We also sponsor medical education, since we know that such patients need a multifaceted approach. So it should be the clinics with anesthesiologists, psychologists, and other specialties. That's why we supported this project. And as of today, we opened 2 centers. It's Feofania and Vinnytsia centers of pain. We plan to expand this project, and it's really needful to have such a center in every oblast to provide the specialized care for every patient suffering of pain. And yet we consider this scenario of the termination of the active hostilities. I don't believe it will happen in the nearest 6 months at least. That's why we relocate our money into a life-saving area. Thank you, Andrei. Now, I would like to say that we have the most powerful organizations in there, which accumulated over $200 million in the nearest time. But I heard lots of very important ideas, like the request for development in involving the teams, medical teams, into the development, and also the issue about the integrity and morality of the people working in the healthcare sector. I will give the mic to the audience for you to be able to voice your questions. Irina Koshkina, please specify your question to whom whom it is addressed. Thank you for the pain issue. But my question is, what will you do with family doctors, since the pain relief, it's maybe if it's a drug, it can be through the prescription of the family doctor. But in case the family doctor doesn't know about it, okay, we have 3 pain centers, but the patients get back to the family doctors, and again they receive nalbuphine. Thank you. Thank you for your question. In fact, the question is quite complex, and we understand that the center of pain is not enough. So we hope to get the support from NHSU and MOH. We hope that such packages will be developed by NHSU and MOH for every family doctor to know what to prescribe. We cannot resolve this issue by ourselves, but we will do our own input. Next question, colleagues. No mic is used. Sorry. Well, I wanted to say what we do, namely for self-governance, that also includes the postgraduate study. Yes, we have to change the medical education in order to have the clinics be able to provide pain treatment, palliative aid, and so on by the standards which continues continuously updated, and so that's why it can be resolved by first of all self-governing, and for the doctors really to keep up their professional quality on the due level. Well, it takes two to play any game, I would say. And that's why everything that you expressed here, so from the side of the, let's say, doctor community, so the doctor has to do lots of different things, not only to work with the patient, but where's the motivation? Where's the motivation? Where's the stimulus for those people who have to know all the guidelines, to read all the newest documents, and like a space level? It's what would be just a new generation to be born I mean, of the doctors with the really presidential level of the wages, since the taxes are being increased. I haven't seen the role of the doctor in everything that has been said. Okay, Olga, would you like to start? Okay, let me respond partially. This year I attended the self-governance conference in Kosovo, in Pristina, and also the lack of motivation, the, let's say, so unwillingness to learn. So it was expressed by Germany, Poland, and other countries. This is not typical only for Ukraine. Plus, we're in crisis. We have to move on. And when you ask where is the place for the doctor, I know this since I have been working as a doctor as well. So when, for example, you don't know what to do with the patient, and you try during the night to screen through all the protocols, all the guidelines, in order to help this particular patient. For example, the first usage of glucocorticosteroids or anticoagulants. Which were prohibited yet in COVID guidelines. So this is the motivation of every single doctor. It cannot be given from outside. So the person should do it by himself or herself.
Це можна
Of course, could be pushed, some motivation, some intensive with academic education to inspire people, but this is the quality of people and self-motivation, and this is my opinion. We should use microphone. We have 3 people with medical education and 3 people without medical education. I think Alexander meant financial motivation. In that case, my opinion, we should follow the way optimization of the network, using the number of institutions to have the concentration of financial resources, more capable center, and the reduction of the package of medical literacy. At least not producing those if we cannot ensure the coverage, because it's populism. Reproductive health packages when was the coverage, better coverage for other quality of life, which is not funded. The oncology for children, the tariffs were not revised from 21, and the depreciation of green 51, and the inflation 44%. Specification expanded. Nothing was excluded. Specification expanded. Got your point? So I have a provocative statement. Critical, important to come out of the shadow, the money which get the doctors to the pocket, but the tax is not paid. This is where the devil's servants taking the bribe, but when the compensation for the doctor, that means that his salary is not sufficient. Same with civil servant. I would like, I have a dream that this process should happen, and people paying for the services would realize that they can insist paying formally for the good quality service, can get that. And very often depreciation of this money, that does not refer to big, the doctor is counting dollars. It's not a problem. This is something to think. Thank you, Vladimir. Thank you for your question. This is really touching everyone. So it's not about the strategy. I think I have a strategic vision for that. When you asked about the people with the gadget running back and forth, see that there is a specific behavior, the generation, millenniums, they already live in their smartphones, and some of the healthcare services are provided remotely. I think that would be one of strategic alternatives that after 3-4 years, some of these services would be digitalized. Won't be corruption, digitalization is an army for corruption, and this is where we are going from the current position with the background and personal habits with the development of digital competences. For me, it's difficult to believe, but I think those people would be there with snobs. We saw that. I'm not talking about big money, but the coverage for the foundation of Maslow pyramid. We are not talking about the big salaries. What's available now will teach them
первинних потреб.
to cover the. I'm talking about the dignity, the coverage for the basic needs. There's a global challenge as well. We have the outflow of young specialists, and in my world, financial motivation does not exist, but there's a financial demotivation because the money is something which reflects the self-assessment of individual. They're not the source of, if the person is not motivated, money would not save this. The money may put a person in the situation when makes the life horrible and spends lots of energy to survive and cannot spend this energy to treat the patients or are thinking. We should ask ourselves not how much money, but how to the nurses may get their earnings, the doctors, the nurses. We have limited funds in the healthcare system. We should save them through the optimization of the work, not contracting the institutions which do nothing. So the money would not be sufficient anyway, would not get that much. We should ask ourselves how they would be allocated. There should be a principle, allocation principle, evenly. This is a principle, or cluster hospital that much, subcluster that much, close to the cluster that much. I have my own principle. I think we should have a principle focused on the talent. That we should have people in the country which would develop what we want to build. We need talents.
Щойно ми вступимо в Європейську
Talents would go to the European Union if they don't have opportunities for the development. If the talents would leave, no matter how much money you put, they would not be.
зарплати повинні бути
The salary should not be high or low. They should demonstrate the future. You may have a low salary, but you may know that your talent makes it higher, and you should feel that your talent converts into the income during your life. You should feel that. The, the talent should feel this game. That's it. I think that to put salary 20,000 for everyone, this is against the talent. That helps not talented people. But so everyone gets the same. That's not fair. Be a budget institution. This is against the shall contract everyone. This is against the systems of focused on talents are tough, but they're not nice. Someone would be offended, but we need to make a choice. Either we need the challenge or we're nice to everyone. Great opinion. This is about the efficiency, about this. This was not about finance, not only about the financial component, but this is good that with this type of brief reflection. Some time ago, I made a project, designed a project. I was in a hurry, and that was the design was not perfect. And they asked me, "Rom, what are you doing that for?" I was doing that if you so do it for the church. It should be perfect. So you should consider perfections. That we should be clear how much or what was the information. If you shared this information to the society and said, people, we have the problems like this, be open, be frank, how that would impact, whether you're ready to talk to the society about your problems, whether we, or are we going to discuss it at the closed sessions where the people are ready to respond. If we speak about the hospital, whether the community knows that they did one surgery per day, whether people know what happened in the, so can we tell the people that we don't need this hospital, which does only one surgery, whether we have the right to share this information with the society? Who's ready to take a microphone? You see, it depends what kind of position you hold. If you work in a non-government sector or, I don't know, outside of the government institution, usually everyone talking openly and free about the problems and looking for the solutions. Unfortunately, historically happened paradigm. When you are in a part of the government institute, you are under the input of huge factors. You know, a number of drivers, which I don't know. I was a civil servant that's kind of automatically. I cannot say force you, but impact to protect what you what you belong to. And of course, most of people who bring up the problem being inside the system starts to fight against these people. And unfortunately, as I'm telling to everyone, we are not able to find like external support. Everyone has to follow the of two parties, for example. So the government has media, the business on their side, and I personally, time was with very few people who provided support to me because they know that I came sharing some values, and some people had a big impact from the system to kick you out, they start to, oh, well, maybe he is not right. And the problem is in the society and the values which we share and the final trust to those people whom we decided to trust. And the comprehensive further boring support for those ideas sometimes boring, and people they get tired. Very often, people get tired. They say, "Oh well, let the other person come." You know how does this? Oh well, is a conflict person. No, he's not influenced. But this is how the changes go. So in external war, we have an internal war. Thank you very much for this question because this is an ethical question. This is about ethics. And from my own experience, our organization, this is a complicated issue. Sometimes we know that the person was treated not properly. We know that because we have consultants with how to tell it to the parents because that was the trust. And what's important for us, would it help the parents? How to preserve the trust to Ukrainian medicine because we believe into it, and not to take every child outside of Ukraine, but develop a system here which would allow to treat everyone here. But the problem is which we cannot. This is what we're doing from Soviet times, and unfortunately, we still have this practice to give up, not to fight. Either in medicine, either in other science and education, we don't have the substance under the formula. You should on the substance.
Я теж дуже дякую за запитання, і моя відповідь на нього однозначна. Говорити чесно,
Be open to people. We should definitely do that. And why?
Що ми хочемо?
What do we want to
Ми
get?
якого життя хочемо?
What kind of life we get?
Якщо ми хочемо побудувати в Україні якесь гідне життя, якийсь такий рівень добробуту,
What kind of well-being?
нормальне військо, якусь нормальну медицину,
Normal army, healthcare. So only the adults which can work with facts, and we need to mobilize the number of people for the whether in education or in the defense sector, but that should be adult. If you treat everyone like kids, it's not possible. We may keep status quo for some time. You'll never be able to get cool achievements only with adults, mature people. If we, unfortunately, at the culture, and I agree to the colleague, there's we should talk to whether you can tell the truth. Give them candies to the adults, very basic motivation, which is really working against the dignity. But that does not have a future. We won't be able to do that. We should talk to people like adults, tell the truth. Yes, it would be painful at the beginning. Yeah, to know the truth is painful. So your hospital is not a hospital, but this is a place where they kill. The house might be a good man, the manager of the hospital, but the people are dying there. That cannot be treated.
І ми повинні просто
We should
досвід дорослих розмов, що їх може бути хороший
have
чоловік,
a good open discussion. Maybe a good person, but
вони можуть це розуміти.
the system is bad. Whether it can happen at the same time. This is my opinion. And the more we accumulate lie, it would be even more pain for us to face the facts. All the problem with medical guarantees, we're accumulating the promises which we cannot follow with mobilization. We cannot openly talk to people. I think that we have only hearers or anti-hearers. Vaccination. We had hearers and 33% of the population was only vaccinated, the lowest ratio in Europe. We should talk to people like adults. Dear colleagues, a brief comment. Fully support all the colleagues, fully support Pavlora. Have serious communication. Whether we are ready to tell the truth is just part of the process. Whether we're ready to tell the truth, we might have a concern. Yeah, we are ready, but whether people understand the feedback system which can deliver, whether they understand that for the elections, whether they can impact the influences. I think there should be understanding of the citizens' responsibility. Yeah, there is some expectation that someone will make the change for you, even among ourselves. So we expect the assistance from outside. Yeah, this is an interesting element. I think the answer is whether people are ready to change the system. To tell the truth is utmost important, but it's important to learn how to hear the truth. Dear colleagues, we're taking our time from lunch. I see that we're having hot discussion. No one is leaving the room. No one is leaving for lunch. Two brief questions from you and brief response.
Ну, не можу.
I would like to ask question, but also comment on what Olga said. We all are patients. We all are patients. We have some expectations from the doctors, so we have to realize what we have to do. So, but your question. The average age of the doctors of rural hospitals is 65. This is about their, let's say, ability to learn, digitalization, and so on. From other side, we have the young doctors, but their wages are just 8,000 hryvnia, no more, and this is really very small. Okay, your question. With that, with all this, in quotes, beautiful pictures, what could be the steps, effective steps, is in order to change the situation? For the new doctors to come and just not using the 65 age doctors. Okay, what is the average age of the let's say all the people in rural areas, not only doctors? We can ask about teachers and so on. Ukrainian village has no perspectives, since it has no work, no opportunity, no leisure, nothing. Since our village has the level of development of 19th century. So why young people will go to such villages? Then we become politicians and not say, let's say, we don't take decisions of changing really the concept of village, but we say let's keep up the traditions. So what are these traditions? We really have to develop the rural areas, and then there will be changes in the local population and stuff in the clinics. Okay. About the doctors in general, again, my idea is from the latest conference. So, again, all the countries told about the aging medicine, aging doctors, and also the same problems as you voiced. And so they advocate not for some wages changing or working hours changing. So, but advocating for some interesting ideas to bring the new thinking. Yes, we have the same issues as the Western European countries, I mean in the rural areas. So these are the trends and tendencies proper to all the Europe. Yes, it's really great to listen to your ideas. So your opinion, what is the term for the chief doctor employment? I mean the term of employment for the chief doctor in Ukraine. We don't have chief doctors, we have managers, and the term of this such a or director should be appointed or identified by the supervision committees, and this term should be specified in the contract, I mean labor agreement, and I'm against chief doctors. I would like the healthcare facilities to be managed by the managers, by the director. Andrei, your opinion? I think the term should be enough for a person, for a director, to implement the plans. So, but yes, it depends on the contract. And so, in the third word, it should be accepted by a person who wants to embrace such a position. Okay, I would say 4 years. I think the term should stay within next 3 to 4 years, and also the quantity of times to embrace this position also should be limited. Let me express quickly. So I support Pavlo. But who will appoint this chief doctor? Since now mainly these are the owners of the healthcare facilities, and we cannot prognosticate, since it doesn't depend on the terms specified in the agreement, since the changes may happen. So I like this idea. I support this idea of what Paula said. Yes, the supervision committee should identify So I would like let's say you yourself should motivate or let's say stimulate the changes. And a quick comment on the supervision committee. So the patients also would like to have the supervision committee in every facility, and so the membership were of 50% should be given to the social organizations, and namely those who really know how to work. This is really a good issue. So we already launched 14 supervision committees. Several of them are ready to be launched. Those who are interested in such issues, so please contact us through our website and to get all the possible information. So I think that this can help every clinic to work effectively. Colleagues, thank you very much for your answers. Thank you for your questions. I think that so we can conclude that we have to get the victory not only in the battlefield but also in the common sense. Colleagues, let's applause our panelists. Thank you. We overused the time, a lot. That's why we should start in half a year, in half an hour, sorry. After
presentation.
Для нього менталочку або
Колеги,
Dear colleagues, in our agenda, we'll have some changes for the better. Well, yeah, we do plan changes, which would be for the better. Now we have some interactive with our participants, and we're waiting for Respect Good Food to join us, as well as colleagues. Kathy, can you help me to get the people from the first floor to the meeting room? We'll have some interactive discussion. After interactive discussion, we'll be able to listen to the presentation of great and interesting individual, Andriy Zelinsky. And after his presentation, we'll have a panel discussion about the urgent need for our hospitals. I pass the microphone to Jean-Luc, who will start the first part, and we'll continue after that. Hello. I do want to have as many people as possible here because this is important for maybe you have your colleagues next to you who are on different. Please send them a message, invite them. We'd like to get them back. I would go with my microphone downstairs, but I'm not sure if it would work there. Okay. We spoke a lot and got lots of understanding. Everyone highlighted their points. We should become reformers, those who make changes. Many of you highlighted you are leaders. In order to do that, to know that this has happened, we need tools and the resources. And our resources as human beings is limited, and thus we need to have knowledge and skills how to preserve ourselves, how to stay motivated and work efficiently, and make those changes faster. And get to the better, get to the victory. I would like to invite the team of mental health from РАЗОМ from Ukraine and Larissa. Larissa and her team. Thank you. In the resource, the recovery of this resource is very important thing. It was always important, but now it's the utmost important, special meaning. And the resource of the leader is something. The leader reflects and mirrors the situation, what we see around ourselves. This is basically the reflection. If our eyes are shining bright, I'm a leader myself. If a leader has his eyes bright when he feels with resources, power, he starts to inspire the others in his respectful team. Now I want to talk more about how to analyze the resource and how to restore the resource. First of all, the resource can be stored in small steps. You should reserve some time for a cup of coffee, for a walk, because you are what oxytocin is that neurons they're much less compared to other neurons, where oxytocin can be produced thanks to what is a movement. It's this is an activity. There's some exercise. If we talk about the recovery of the resource, and now I want us to try a technique which helps to restore the resource after stress. when there was a discussion, the first discussion, I felt that the atmosphere in the room, everyone had something inside himself or herself. So someone made a statement, articulated what happened inside. But this is a sign that the adrenaline goes up. Some biochemical processes are happening inside our body. It is important when you are under stress. We know that there might be a positive role for stress, but when the stress is very positive, still impacts our body. Anyway, when the adrenaline level goes up, when we feel some tension, it's important to stabilize ourselves. One of the techniques is to focusing. It has very good outcome. It's a proof technique, evidence proof. I'm not going to go for neurobiological effect in details, but it works. What the thing I want us to try before the next panels, before the next discussions, you can do it with your eyes closed or with your eyes open, but you should stay focused. And let's think of the level of the stomach, and we can concentrate on the level of our stomach. We're do some with some body dynamics. So we are focused on what's happening at that specific zone, and then we try to see what's happening inside our body. Yesterday we discussed a triangle with the thoughts, emotions, and the body. And through the body, we can impact emotions and thoughts. See what's happening inside our body, what's happening to our legs. We focus on our legs. What's happened to our chest, our hands, our back, head. What's happening inside my body? Where do you feel there's some light in my body? Where do you feel it's not any light feelings? Then you can make a slight breath and breathe out. Breathe in and breathe out. And then try to open your eyes and let's what's happening with myself. What if we were able to come down, those who were included may notice some processes like stabilization. Why breathing in and breathing out is important, because when you breathe out, thanks to what we breathe out the air, the adrenaline level going down. We try to, so under panic attacks, so breathing techniques are used that focus on breathing out, and thanks to this we can stabilize the person and they get out from the panic attack status. Thank you. Thank you, Larissa. Natalia, are we ready to invite our guest? Dear colleagues, I want us to welcome a great individual whom we were waiting for impatiently. Many of you have heard, and I think you expect for this great inspiration to continue the work of Andriy Zelinsky. whether we need to provide any more comments additional, because everyone knows about Tantra. Great. Can I get my presentation on? So if will I get a clicker? This is technique. Is important for the health. Otherwise, when something does not work, when there's no mechanics, no techniques, all the rest remains only good intentions. At least I have a clicker. This is the first victory. Now I expect the presentation. Dear friends, the purpose of our meeting, I think many of you have been already my presentation, but let me talk the way that we meet for the first time. We will talk about a human being which develops with time, and time needs people in order to secure good quality interaction. One of the key requisites from an success, good contact with reality, and today we'll try to think of the mechanisms which can secure good quality contact with reality. Otherwise, reality requires that. It's important that we would be able, in this context, on one hand, oh, great, we don't need chairs. We need to move them away. Technique and mechanics is always important. Otherwise, we have intentions which should be implemented. See the topic, and that would be the second or two victories during one day. That's a lot. That would go to our wallet, and this look like a content. Now we need to fix that. So anyway, we're going to talk about the anatomy of the soldier. Time required that people would be able to use with time. On one hand, we would have good quality life, opening our potential, and with our we should share with the others. And this is an endless problem. The biggest problem, the biggest challenge which may happen inside someone's life when we are a bottleneck in the universe. The life was before us, would be after us. We made a jump into the river at some point to get out of some, but it's important not to be against the stream. The events on our way would either make us stronger or would limit our capacity, and everything depends on our attitude. So the soldier today, this is about archetype. This is about the being, about what I just mentioned, methodology of interaction with reality. Our time requires people, soldiers. This is not about competence. This the civil statutes. This is totally another dimension. The competency is the profession. They were trained, but the soldier is the type of character about the individual, a specific point in time, specific circumstances. Let's try to understand, and I'm sure that you already have your own toolkit how one can deal with the context, with the challenges of the. So, soldier is one of the means. You may have your own elements, but we're talking about the human being and the link with the reality, with content, in order to secure efficient, good quality outcome. Okay, so today we are in the world. We are here in Ukraine. We are in the world that time not simply required, but time, the situation, the events are very tough, a huge obstacle to our life, our development, our professional activities, and requires, if we speak about the health sector, people who can overcome the challenge and ensure the result. And if we talk about the proper level of leadership in the health sector, people not only overcome the obstacles and ensure the result, but one of the important features, people organize the others and secure good quality interaction, challenges, and the outcome which we want to get. These are the dimensions where you operate today, the dimensions which I should not to become an obstacle for the development of the universe. You cannot let it go. This is our time, and this is an important element. Sometimes people think, oh, well, we should live through war and other obstacles, and it will go by itself.
It cannot be this way. It's your life. No one will compensate your time of your life. No one. And that's why our link with reality. So, what is the link with reality will depend whether or not we will come out of all this endurance with a new experience or just the stolen life. Since the active facility started in 2022, and it's already the third year of our lives, and someone already started this, let's say, live yet in 2014. So we have to say to yourself that this is our context, and so the resilience model, I mean, the best of the best of what is provided within different trainings. This resilience model is dance, tango dance. So you have a partner, you have to be in time with this partner. So I mean, there's time to accelerate, there's time to relax. Since the resilience is about the dance, yeah, I mean that's how you dance with all these challenges. Since you have to do sometimes what you don't want to do. So it depends on you how you will dance, how you will dance it. Since the challenge, a challenge that costs a whole life to someone, this is the challenge that deprives you of your, let's say, capabilities of your relatives, how to become not some plug of the universe, but to be stronger. So first of all, you should realize that this is our life. No one will compensate it. Again, the second, if it is my time, if it is my life, so you have to dance, and you have to dance your own dance in order to go out of this dance alive and strong. So the situation that requires from you additional abilities or capabilities, for example, when you are in the trenches, okay, this is the situation out of which you should come stronger. And that's why the future of our country, the biggest percentage. So if the, we can speak about two categories. So those which sit yet in classrooms and those who sit in trenches. And where's the medicine? The medicine that provides the sustainability for those who stay in trenches and those who stay in classrooms. But again, this is your time of your life, so you have to learn to be a warrior, a combatant. I'm telling not about a soldier, but about the character of how you interact with the reality. I like this photo very much. This is about the soldier. The soldier. So where
Загального продажу. Там є ось цей сюжет також нарисований. Зауважено, на якій функції виконати. Перше, потрібно здолати море.
again, this marine, what he has to do, first of all, he has to cross the sea to keep up his arms well, let's say, well functioning, and to implement the objective, implement his mission. And again, so his life is the sea where there are plenty of risks. And so, can you imagine any storms? I mean, not imagine, but let's say plan any storms beforehand? No. So the sea, it's always a threat. The sea cannot be planned. So same goes about the world. So, and here you see a marine who has to, what? To get across the sea and to implement his mission. So, what we have to learn? To overcome and achieve. To overcome the sea with unpredicted risks, threats. And yet, I published in Forbes journal my article about the qualities of the soldiers. And you have to know how to drive a seashore that you have to attend to reach, and for that you need a team. So a lot of you work with teams, so you have to know altogether where to swim, why the sea is so much unprotected, and what is the sense of the character of the warriors. So the warrior has to time the sea in a way to achieve his mission. To achieve his mission in this chaos. So you have to see your horizon, you have to see the objective and the life of the warrior starts with the objective. Yes, and sometimes when a dream is raising on up the horizon, and with this dream comes at the dawn to someone's heart. And so when this dream comes to your life, so the warrior is born. And when its heart and horizon become the integral when, so that is when you calculated what you need to achieve, how achieve this. Okay, so this is, yes, this is analytics, but the warrior can be also a mathematician, or a mathematician can become a warrior. But for that, the heart and the horizon should get united. So you should feel this horizon with your heart. What you feel, what you realize, it should be in line with your objective. And so you become a single whole, and you keep up your dream. You become an objective for yourself, but you should feel every step of yours. You should become yourself. And so in my book that it calls The Anatomy of the Warrior, I write that a person is born within his or her journey when he or she feels a personality that he or she wants to be or to become, and then you become yourself. Everything is programmed genetically, so the tree will become a tree and so on. Yes, something can be corrected by the outside world, but this is up to a person, to a personality, to decide what to do with his or her life. And so when your heart keeps up to horizon, when they become a single whole, you are born as a warrior. And so you can overcome any enemy of yours, any obstacles, any conditions, and then you become committed to your objective. Now let's talk about the anatomy. So I created or identified 4 personalities. So when someone started to tell that, okay, I'm just the one that they see in the mirror. So, the mirror gives you the so-called 2D image, but you are much more than 2D image. And so the time calls you for a dance, and for the chaos to become your dance, you need the anatomy. Again, this is about the ontology of my subjectivity. And again, we learn Leonardo da Vinci, Jesus from Nazareth, and Alexander Macedonian. So Leonardo da Vinci examined 30 bodies, dead bodies, but he dissected a living pig. And so he wanted to study a heart, and so he did. He says that the beginning of 16th century, then we got the empiric data then that Leonardo dissected the live pig in order to examine how heart is beating or contracting. So again, Leonardo represents here a whole humanity. And so then he printed a whole set of the pictures of anatomy. So the humanity got nothing similar before Leonardo, and plus he created genius, let's say, technological objects. Well, I can talk a lot about what Leonardo invented. I mean, the diving suits and so on, the helicopters. We are talking about the end of 15, the beginning of 16. So what concerns aerodynamic, and then the Newton developed afterwards. This is all about Leonardo. Was quite a complex personality, but he got one complex since he was, let's say, a self-learning person. So, since
він сам вправо роздирав свиню і дивився, як скорочується серце. Як скорочується серце, він м'ясо.
So he has to study by himself. So he has to learn through his own experience. That's why he dissected the pig alive. So, and over there were no academies yet, and Leonardo Leonardo da Vinci discepolo di esperienza. So Leonardo da Vinci, the learner of the experience. As you see, he got no diplomas. He graduated from none of the university. Again, the world of the chaos, where you have to swim to reach the horizon, to reach the seashore, to implement your objective, where you implement your open contact, for example. And so, again, about the anatomy of the character who's able to overcome all the challenges. So, spirit, path, and power. They make warriors, say, everywhere in the marine, in infantry. So let's start with the spirit of the warrior. So the warrior should have a spirit. The warrior should have a specific attitude of not to be scared, not to stop, since a person can die because of any bullets or any, let's say, gun. But when the warrior dies within a human being, then the human being is defeated. So again, in this case, so no one can achieve the objective, no one can get the victory. So I'm speaking metaphorically, but we can extrapolate all these things on our reality. So our starts with personality. We construct our personality with our attitude to our activity, to our life, to our word, and then how we act. I already mentioned that every person is at least 3D, let's say, object. So we are consisting of the attitude towards me, myself, toward the others, and toward the world. So the attitude toward yourself is the so-called mental construct. I'm just the thing that is in the mirror. So, and these three attitudes make my personality. When talking about a warrior, we're talking about such a personality, such a spirit that helps me to have a qualitative relationship with the world, qualitative relationship with other persons, and with me myself. In case you miss any of these three, you are, I would say, defeated. You will not get any resource in order to do things in this life.
Процес.
This is a process. So we develop ourselves when we speak about construction. Let's make a small step. For your understanding that you live in the constructed world, we reality, the environment which exists without us, but we interpret. This is interpretation process of what's around us. Reality is all that. This is what we think based on genetic factors. We live in the constructed our reality. You should understand that you feel sad, and then everyone who's next to you will feel sad. So the world where you live is your attitude to the world, to the others. Then the freedom starts. So you should use this. So going back to if it's a constructed world, simple things, day, night, basic things, something you may touch. But for you to understand, there is no day, no night. We just imagine there is some space on the Earth which is moving. So there's some lights from the sun. There's some light. So the Earth continues to rotate. The day does not come, does not leave. This is just a rotation around the sun, and there might be a duration of some light on the surface. Night is not coming. This is true. The night is not coming. Not even simple things. You go, oh, so what's above you? Sky? No, no, it's nothing. So this is our mental construction. We call it a sky, and we accepted the way it should be. So we constructed the reality. And one of the important constructors, time. Whether time exists? No, we invented it. Yes, there's Earth's rotation. We decided to split it by 24 by 60. Okay, we divided. This is us. 364 or one more day. This is the way we live. Time is mental constructed, allows us to survive because this is a step of the way. We can sort out our biological wisdom. We can find time to recover often resource at night. Maybe there's some people work at nighttime, relax at daytime. Um, this is a psychological and biological survival. In order to live in this constructed reality, we need to reconstruct it from time to time. Sometimes we need to shift the furniture. The person becomes himself. there no static, but this refers to the social concept. Nothing is static. Everything is moving. That may become a chaos unless you manage it until there's a barrier which is born in your heart and would come to the goal, clear step to life is a movement, you know that, but it's not a dream. A movement does not mean a dream. You may go in circles, you may stand still, you can waste your energy and time. You live in this world and never get anywhere. The warrior should have a horizon, go, but feels every step. Don't be confused. The warrior has a high horizon and feels every step without feeling a step, without a taste. You'll be lost. You won't be able to restore your resource. Without a goal, you can go circle, stand still. The warrior is a high horizon and a step towards this high horizon goal strategy. But this is the ability to live here and now, the ability to feel what mental health are two specifics: sense and taste. Should see a sense. We construct it as well, but they construct it under the situation during the chaos, any sense to find any content to verbalize it, and at the same time feel the taste, minor taste, which are important as well. There might be brand new car, but without a fuel would be standing in the middle of desert without ability to get anywhere. We need a spirit, we need a power which allows to move forward. We need development, ongoing development, because development of good quality contact with reality, interaction with reality, which feeds us, which helps us to find a sense and taste. And this development should refer to all the main dimensions of our character: body, mind, emotional potential development. Development is better than nothing. So the trap is that I started developing on Monday, but Monday started jogging. Oh well, Monday is a tough day. I will start Saturday. Oh well, I need to relax on Saturday to recover by Monday and think of the jogging. Yeah, and this is the way people dream all their life. Most of the people become hostages of their own dreams, but they're not dreams. The dream is a horizon which change your life and your interaction with the others. Something. But the dream changed nothing. It's a kind of blinking light all their life. You can do that. You were able to do a lot, but unfortunately, you didn't care to get out because you found a shelter, and you refer to the shelter as a it's a movement towards the horizon. So the music, listen to the music. The development helps you to localize this energy, not to waste any single moment in that world. Before we go back to the development, when I speak about the construction of the reality, one of the basic mechanisms which we use to construct the reality, verbalization. We verbalize what was not called, does not exist. What's an out of second? Do you know what is fermion? Until today, you were dealing with massing without any knowledge of what fermion is. But the second is 10. This is a Nobel Prize from physics. So This is a very small share of the sun.
Це одна секунда по відношенню до 62%. Тобто всесвіт.
It's, I'm not telling you, Phil, this is a Nobel Prize winner in physics. This is what about this is outer segment existed forever, but this is a jump from fermion from this very small particle of the substance before photons and the others. This is what is in the phone. And we didn't know that. We didn't know that those exist. My point is that we, for us, something exists if it can be called your body, your mentality process the information which comes to your brain. So it's important. What are you doing with this? How you verbalize it? By the way, we step. Oh well, no clicker. So it's a problem. Someone say, "What do you feel when you hear the problem?" So there's some association. Oh well, your wing should get tense, but getting tense means that you spend some energy. But there are other words which can package this phenomenon into other construction. Now, the challenges. Academy leadership back in 15, we liquidated problems in our glossary. Just try it. Change problem for challenge. So say, I have a lot of problems. So, I have lots of problems, but then say, I have lots of challenges. And what do you feel? Totally different perception because challenges will mobilize internal resource. Yeah, we need to move forward. The problem that some blocks you. Language has a meaning. We have the world which is packaged into sentences. Whatever is outside of the sentence does not exist. My point is that you should develop your capacity. Wake up, basically. Understand that the reality, my reality, the context of war, whatever is happening, for me, for my attitude, may look like a problem without any colors, no sense. If you're responsible in this life for someone, this is about leadership, you should have a feeling of your capacity development. This is much more that you see in the mirror. You can do much more. You are not a flat thing. You are a multi-dimensional individual, and this is the result of your attitude to the world. The world is a trap, a challenge, opportunity, and others are competitors, enemies. Might be a team. Myself, well, just a regular Ukrainian, depends on me, or I'm an individual. We can construct the world, who can be aware and swim and get to the shore. And that's collective traumas. Something existed in myths, but this is text. Text is a language with structures, with images, and respectively verbal construction. We packed our Ukrainian language, but it has lots of verbs and passive status. This is a classical sample. The plate was broken, like broke itself. How the plate can break itself? how a plate can break itself. Someone broke a plate, but that means a freedom and responsibility. Oh, let the plate break itself, but that would be good. It, how it will happen? At the panel discussion, someone asked me about the dangerous myths created in Ukrainian culture. Look, everything will be okay. This is the most dangerous myth. How it will be? How can you explain me that people are the creators of the world? We created the world, either being active or not active. No other options. We tuned into interaction, got certain results. Otherwise, we hide it ourselves in a shell. So everything will be do the upgrade. Okay. Oh, well, it would be okay. Will be, but was okay. It was and is and will be okay, but there are links with the past. I am trying to return the subjectivity, your freedom, the freedom of the warrior. The warrior is waiting for you to wake up, and you will notice the horizon with your heart and create your life, your organizations, and those who are next to you, because the world of people is created by people like Leonardo, whom I already mentioned, Einstein, and other individual. The world which we're living. Not because Leonardo woke up at one day and decided, oh, well, I will be liberated. They were interesting. There was a curiosity, and they were able to surprise themselves. How one can get out of the shelter when the context is not a good one. Surprise yourself, and the surprise make a person a free person. So we need development with the good quality contact with reality, emotional, physical, and intellectual. Physical is easy. Any exercise, do something in the morning. Jogging is kind of sophisticated for those who. 2 copies is better than nothing. So when you have a big program in front of you, I guarantee you would not last long. Why? Because there are lots of other things which require your energy, your life, and you are alone. Make small steps. So do the analysis, what it did for my physical development. Uh, very tired and you will not manage to accomplish everything, and another day is almost over. Don't go to bed as a loser. Never think, oh, shouldn't 5 jumps, but you gotta go. You make efforts, and you reach the result. This is very important. This is the basic algorithm for the transformation. Any transformation, individual, collective, transformation that decide. I set up a goal in front of myself. So which can be worded unless there's a formulated goal that remains something abstract. The goal should be worded. There should be then the effort should go, and that requires something from you to topics better than nothing. And then I start to believe, oh, I can do something. I was able to do this. Tomorrow I will be able to do more. Then after some time I'll be able to catch a wave and would be able to invest not a green or even 100 degrees. It's important to control at the end of the day how much you put in the bank for your physical, emotional development. Emotional development is very important. I'm talking about the development. Whether you've heard that everyone talk about how to survive. I'm talking about the development for survival, which is different thing. Now you think on to survival. Oh well, that's nice. When you have a horizon, it means like a horizon. A Ukrainian philosopher quoted me sometimes that I'm using the horizon. That this is the line which would run away from it because this is an imaginary line. The tree on the horizon is a specific. I can catch a tree, but the horizon is not the. Should, this is about development, but when the horizon becomes not a finish but a start, this is the line. I start my movement. Transformation of the horizon is the sign of development. That when I get there becomes a new distance. A horizon is that makes sense. You feel something, you feel different when your heart is touching the horizon. You can transform yourself. This third point, I see the outcome, not reaching the result, but I can see the result. Important leadership capacity. The leader always can see the resource and see the result.
Діти будуть за
The others will not see the resource, since the resource should be planned from the side of some public organization or state budget or so. For example, we should have done this one, but we didn't, so everyone is upset. But it's not the leadership approach. Okay, we didn't do everything we planned, but we really moved on. So we had to walk through 100 meters, but we just passed 30 meters. Okay, then let's think over. Maybe we will transform the technique, the approach, the context, and then we will make another try. So someone has to do step by step, others have to time the C from the first step. So, and one of the leaders' capability for example, again, where the Achilles is buried, do you know where? It's a whole world in front of you, so please wake up and start searching again. Those who studied the myths say knows that Achilles is just a source of inspiration, since it's the warrior of the warriors. And for example, Alexander the Macedonian wanted to be Achilles, and so he read all the books about Achilles, and when he really beat Dari, I mean the Persian Tsar. So he said, okay, now I know how to be a king. Okay, they found a very expensive box. So they started to think what to put in it. So Alexander was just a simple person, and so he puts in this valuable box the book about Achilles. Why? Because this book helped him to identify where to go. Again, where the Achilles is buried. So he was buried on the island. The island name is Viper Island. Okay, do you know about it? No? So what do you know about yourselves? You really know very few about yourself, so very little. And again, what do you know about Achilles? He's got so he has a heel, and so he was injured in the heel and died. So she has its weak place, a heel, and just imagine if Achilles knew from the very beginning that he has this heel, this vulnerable site. So, and when thinking about it, he maybe would have never gone to fight. And again, everyone has his own heel, his own vulnerable site. So, what should you do? Just take your helmet and go to battle. Just follow your horizon, follow your heart, and you will be a leader. You will lead the others. Everyone has its vulnerable side, but the world is created by the people, the same people as you. So, yes, everyone has his own hill, but first of all, you should not lose your path. And then you have a technique. You have a technique how to deal with the outer world. For example, when do you know about this story, the Persian and Spartans? So, of the 300 Spartans, and the person told them, "So, let us pass, and you will stay alive." No. So, Molam Laber, just come and take. And this is the algorithm of every single victory. What is a victory? Is achieved goal, mission, fulfilled. So objective, efforts, result. This is the algorithm of every victory. We're talking about our just daily things we do. So any single victory is never given. You should come and take it. So you should come and take it. Stand up, get out of the trench, believe that your heels are not the vulnerable places to sight. So with them you can move on. So, and you should know how to lead. If you want to lead all others, you should be someone for all the others to be led. So by you, every dream needs a resource. I think not everyone in Ukraine understands this. You can dream, but first of all, you should have a resource. Without resource, a dream stays a dream. And it's not some finances, maybe it's some really capital, maybe moral capital, that can serve as resource. So, first of all, you should know how to see through a fog. To see a fog, but to see through a fog. Since a victory, this is always a team achievement. So the result needs the aligned coaxiacy, and then you will get the result. When people will believe in you, they will believe in your dream, and you don't stop, you can lead them, then analyze the actions you do. So, first of all, the analysis of your own development, analysis of the actions, and then you can come to a next level to form another dream in order to time the chaos. So there should be a dynamic, the specific steps, and you will not be awarded for this, but this is yours. You will become a happy person. So you will know why do you leave. You're not some clog on let's say blood flow path. The motivation is your own answer to your own question. Why or what for? Why should I wake up in the morning? Why should I beat my heels? Why should I move forward? Okay, when you find an answer, this is the fuel to move forward. So the main thing that I got to know after I studied the military doctrines of NATO and other countries, so Unify and Multiplier, this is a letter by our Canadian document. So Unify and Multiplier, it's not like they say a formal position. This is the one that can unite and really increase or empower. So this person will be reached for advice, for support, for a challenge, for some knowledge, and so on. So in other words, in case people are surrounding you like bees in a bee hive, so people feel really more confident when they are at your side. But every change needs a power. So every change in yourself or in the outside world, it's a change, and the change needs a power, needs effort in order to achieve what we dream about. And also you can find the answer why. So for the answer why, this is why not to do, for example. But this more important is the motivation. Let's say what for or why. Again, you should find your power. You'll see over there the response to the question why and what for, and so you'll find your objective. So the person cannot be happy if he or she is not free, when he or she stays in some trap, and not to become a clog into the system of the universe. So you can play any single musical instrument, for example. But maybe it's not appropriate in the medical clinic, but it can fill you with power, with your pleasure. And the pleasure, the satisfaction, this is what gives you the power. Then you should get rid of any complexes that maybe are later and from the very childhood. So it's your final vocabulary that you should form, but the reality is much bigger. So the fear, the anxiety should be put aside when I see the source of my satisfaction, of my pleasure. How to develop it? How to develop this resource? To invest more time. So what do we do? When we do something, we master something, so we become masters. Then, in case you cannot achieve it, so please, you should analyze, and then you should convert reality into the real one. I mean, our own dream into the reality. So, for example, I could ask you, what are these green objects that you've seen in this audience? Well, again, you got this information, but you never realized this information. Again, the analysis helps you to analyze what you see. I mean, to analyze your resources. And when you have power and resource, you have to achieve. Again, the achievement of the result makes you much stronger, and then you feel the appreciation to those who helped her or him to go through all the endurance on your way, and you formed a team. And again, the final word that I want for you to keep up with yourselves, again, who is the word? First of all, the personality linked to a context. You create yourself, and you are or the victim or really a winner. So to be a warrior in Ukraine today is to study in the context of war. Why? Because it's own time, your time, our time. No one will compensate you this time. So this is your time to become stronger. Thank you very much. Thank you for your attention. Be stronger. Be strong. Colleagues, a big round of applause. Andrei, thank you very much. And again, I would let me mention that Andrei Zelinsky stayed with us. He's the founder of the Institute of Leadership. He's a politician, chaplain, and philosopher, and a writer. And I think lots of you have been inspired by these words, and never go to bed as losers. Go to bed as winners. Thank you very much. It's really inspiring. And now, please, I would like to ask technical assistance to accommodate a place for the panel discussion. We will have 5 panelists and a moderator. Altogether, we will have 6 chairs.
Попрошу встановити таблички.
Please put on the table and all that is needed.
Розпочинаємо через 1 хвилинку. Якщо в нас є гості на першому поверсі, будь ласка, попробуємо їх покликати для участі в панельній дискусії. А колеги, я запрошую на
colleagues, I would like to invite here on the scene our guests. Oksana Jam, the director of the primary healthcare facility from Bucha, Radia Shevchenko, the director general of the emergency medicine from Dnipro, Evgeny Chernok, the director of Ukrainian State Medical Social Center for War Veterans, Igor Smysla, the director of the Oblast Pediatric Clinic, and Lebedev Tatiana, director general of Chernigiv Oblast Pediatric Hospital.
Вітаю, я сподіваюся.
Welcome, dear guests. I hope that you all will be very well motivated. You got your food for your brain, for your thinking. Let's get back to reality, and we have a very important topic. This is the partnership for resilience. So I would like to start with a question, and I would like to ask every of you to this question. Yesterday we have already talked about it, but we want to collect really every single thought and idea. So please tell us what is really critically needful for you today. Please name these three aspects that you see the most required from the international donors.
After Andrew's presentation, the philosophy coming to practice this kind of life, we do need to think of the real partnership. We speak about integrity. For me, it's integrity and partnership from the time of occupation, the occupation of butcher. It was important to find the kind of the support which would put everything related to healthcare assistance to a proper level, and it was about partnership. I spoke with them that the focus of the timeliness of the issue, what you need now, medical equipment. And I was fair with them. I was because I spoke to the primary line. They were about to bring everything, but no, I did not need everything, and I discussed with the hospitals what they need, so that they saw that I knew the situation. We spoke about the energy independence, generators, solar panels, the batteries. We spoke about the safety of medical staff. Interesting cases we had. What we had in the community and the protection of our territorial defense. And of course, there were discussions about the long-lasting future. Next, what we discussed with the partners, the cooperation, not shared the cooperation, that we are joint mission when we fight the enemy. We are kind of one boat, and with partners we were open and had fair dialogues that inspired them, that gained their trust, which was developed through openness, through transparency. All these components, integrity, I try to keep all the way through with myself. And I think I should let the colleagues speak. Thank you very much for the invitation. Mr. Daniluk asked me back in 21 if there's a full-scale invasion, and it happened in 7 hours. I think a horizontal and vertical communication, we should get rid of pseudo-assistant, which exists on every level, unfortunately, and with the lowest level. We managed to do something, and there's a confirmation that we achieved our goal, and we didn't make a mistake. The emergency service works. We deliver thousands of wounded every week, and we're efficient. Emergency medicine. We are efficient. Over these 2 days, no one mentioned emergency service. Means that the extra injections, and you are not able to support. We are 37,000 indicate, and the salary fund 65 million per month. The salary fund. So we create many brigades. It's important for us to keep the cadre potential, have less brigades, and the recent terrorism was thanks to our great one deputy minister changed the funding for our so it happened basically overnight. So able to operate. And what I see as a need in cooperation with international and national donors with our service, we should have a common denominator. We should communicate more with one another. A case of anti-communication was last week. There was an episode. I got a call from deputy director from one of the sectors. Brother, you have the donors with 12 new defibrillators. I got 6 the needles for insulin syringes. We need to change context. We don't need vehicles, but we need to keep the cadre potential. Better give communities funded from Hungary. They pay extra to all the teachers and the doctors. Kiev pays to the doctors extra, so we won't be able with the injection from point to point, but maybe you get united and do something at the national level. We start with the regional. In the Dnipro region, we have 3,000 plus. You may help us with a very full. Thanks to the ministry and to the mother, we replace the vehicles, but it might be the case that we will have no one to drive those vehicles. We should look for genius people, but we need to keep those. And partnership for sustainability. This is what who we have here in this room. Have the most strong ones left. Thank you for the invitation from Sumy region, Children's Hospital, Oblast Children's Hospital. The specifics of every region, Dnipro is in the same situation as our region, but when there's a issue, what are the 3 needs? So for every region, how could similar problems could be in the west, central part, and close to the continent? These are fantastic things, totally different needs. The challenges which the institutions are facing are absolutely different. Can we compare emergency assistance hospital adult children, we're very different. And it's not the point that you secure the salary fund. It's not the point that someone would cover us with all the money. What I have on the wish list, we should communicate with the representatives of society organizations, international, local one. They should learn our needs on site. Oksana was great to mention. We're doing same thing. We're in the same business, same boat. But if we analyze 2 days we spend together, we're sort of on different sides of the barricade. Sometimes this society speaks that, oh, well, you're not doing this, you're not doing this, you're not doing this properly, you're not perfect. Yeah, we know that we're not perfect. We're not about the victory over everything and be perfect, but we're about the way how to get there. So in the first place, I think every organization which is ready to create a vulnerable system which would be better at some point, they have the advantage. A limited period of time, they can help at some specific point where it might be critical. And we have cases when there was a very targeted assistance, which cannot be compared to our budget assistance, 0.5% from our funding, but it was very timely, very important, which made a real impact. Next point, we'd like to get back to comments which Vitaly made, to hear one another, to talk to one another about what's happening. And this is important when we can hear to one another, when we can communicate the feedback, what are the opportunities. From my practice, when some organizations come big or small, ask about our needs. It's just a very broad question about the needs. That from the big ones, global ones, from the big one to minor ones, which should be fixed as well. The point is that thanks to this assistance, we get our hands free and we can make a next step in our development. Pediatric service, there was no single period that funding was great for the pediatric service, that everyone applauded. Same with the cancer service, which have lots of funding on their accounts, which would allow to make a great jump. In pediatric service, there was never a case. So in this situation, let's communicate. Let's share what you can do joint. To hear one another, be open, speaking about the opportunity, what the hospital, civil society organization do. Let's cooperate. Thank you for such a long speech. Thank you. I would like to compliment communication. We was several times. We need to communicate. So that's an important comment. What would be your advice to NGOs? How, using which tools we can ensure the communication on all the levels, that we should be in one media, other than having meetings once a year? If you're interested, I can, from my experience, there's no case that to have talking. it's- it was a great opportunity for us to talk to one another, talking to the colleagues from NGO to share the case. When an NGO comes to us and say, so, Chevelle, you wanted this. We did one. Chevelle 3 years ago during COVID. But then, and it was mentioned over 3 years we got lots of other stuff. It's not up to date. If someone is interested to implement a specific project, and you should come to spend some time, a day or two or three, working not only with the directors, with the department. If we talk to make an on-site visit. There are NGOs which work on comprehensive approach, and that's great. They have great cases. The reps were here, and I had the honor to express my opinion about the input from the perspective of the comprehensive approach. They do the needs assessment very often. Now, not a year after. I don't understand that we're able to guess what we'll need in a year, but the point is that you can do it yourselves. Yeah, but we'll not have to work on site is a project approach. One region, one institution, if the resources are available, you can see what's happening on one institution. Not get a paper request, like 3 pieces of content of that, 2 of that. You should see on site how it works. If you have experts who can assess where the bottlenecks, where the, maybe at one of the institutions, the mental health problem, and the other, there might be a problem of inclusion. You need to fix that part. Someone definitely may need equipment. Someone has a bottleneck in this, and the patient have to pay because the funding is not coming. There is no unified answer, like recipe for the for everything. So that's not the point when size fits all. We are a utility enterprise which provides assistance. This is important. We got a clear advice. Thank you. Tatiana, the microphone is yours now. Thank you for the trust. Thank you for the opportunity to speak to such a offers. And when I saw our speakers, I did want to be part of this. I'm in charge of Oblast Hospital, regional hospital for children, and the year 22. So our challenges are clear for everyone. But in our case, Chernihiv from February 24 to April 7 was under severe shelling, that led mass evacuation of the population, specifically women and children. Year 22, we ended up with the reduction of the capacity. Next, that led to the point that the grant for the National Service of Ukraine led to the reduction of funding. That became a critical. So our region is specific. We don't have funding from the oblast. So we were about close to the bankruptcy. But to keep the staff, the labor potential, payment of the salary. feeding medicines, how to secure that, and people started to come back. And the point is that at the end of 22, we realized that 80% of those who left, they came back, including children. 100,000 children were in the territory of the region. We felt that because of the number of applications to the hospital, and partnership helped us year 20 Q3, Q4, year 22. The hospital got assistance from civil society organizations, from charitable funds, from the producers. I had communications with the government for 17 million greeners. 23, 12 million. НОВА Ukraine, РАЗОМ, International Medical Course, the International Migration Organization, medicines, equipment, hygiene and disinfection. I want to thank everyone for their help. Thank you. Actually, it was really a painful issue for any manager, especially for the hospital manager. We have 600 staff plus, but hundreds of thousands of children that would perform out as, but we need assistance.
День.
As of today, what for me is partnership fundraising. I understand that there are people with so-called open souls. They give everything to help the people, the other people, what we can. We can guarantee the honesty, the transparency of usage, what we got. So reporting to donors. And I think we hope that with all of that, the doors for partnership will be open for us. Then we provided everything possible to be independent. We got the power generators, the solar panel. We even have positive experience of the partnership among several organizations in order to implement some project. For example, the solar panels were installed within one project with 3 organizations, and still we have challenges since what we get as funds for from the NHSU, we cannot pay all the medicinal products that are needed for the daily work of our doctors. Next, we get the challenge to accommodate the shelter since the Oblast Pediatric Hospital in Chernigiv, we don't have the shelter. We just use our basement that we accommodated more or less with our own efforts. So you need the additional financing and support. So I can conclude. Okay, you shared with us the successful case of a good partnership. Could you provide your colleagues some practical recommendations on how we involve the partners in these successful cases? So what did you do for that? How you get your partners? Just some words. Well, here, as Andrei mentioned, what motivates us? The dream. First, we got a dream. We got several addresses of charity funds and charity organizations. So we started to send letters, to send requests, and so everyone told us what they can do, and everything happened through communication. Yes, through communication. I wish everyone a good, strong health. So you asked about partnerships so far. Yes, so I remember I heard all the participants, but again, let me mention that if we don't classify the partnership, there'll be a chaos, really. So, yes, it can be macro partnership, long-term partnership, micro partnership, I mean a small one. It can be spontaneous. So, one-time partnership or so. So, again, after you identify what kind of the partnership you need, you'll get what you want. So again, it happened to me. I headed a healthcare facility before, and so we built our own partnership through our own relations, links. But it was kind of chaotic, spontaneous partnership. And now I'm heading a much bigger facility. I have over 800 employees, over 600 patients, and now I see this partnership that we got. So it's a long-term micro partnership with the World Bank to reconstruct our buildings. This is one area. Next, we got 2 tons of potatoes for our kitchen. This is a micro partnership. Again, next, I tried to use the defibrillators, old ones. I tried to find the accumulators for them. This is another type of a partnership that I would like to establish. But again,
Але за це партнерство волонтерство потребують щось їм.
When someone says, we are volunteering and we will partner with you, but we need something back from you, this is not a partnership, this is not a volunteering. So in the sense, like, we helped you, now you should help us, or you should reimburse us in some other form. It's not a partnership. Since it's not solid, and so I know that we wouldn't survive without partnership. For example, we need electric buses for 10 to 12 people to transfer my personnel, since we are like 100 kilometers from Boryspil, 85 kilometers from Cherkasy, over 100 kilometers from Kiev. So this is a really a problem with means of transport. But when I talked to one person from MOH, for them to help us this electric vehicle, so I received the response, well, you're quite smart, you will find yourself a partner, so you can do yourself. So is the answer that I got. So in case you really systemize or classify the partnerships, that you'll be much more successful. Yes, the partnership is quite needed, but yes, I understand that what you want to say is that yes, we should identify the dream So we try to teach this during the training, but again, there are such tips like you should note for yourselves all your tasks and specify whether these tasks are done or not. And in case you do this, you're in a good way and you'll reach your dream. Let me get back to you, Oksana. How you see what we have to do for the international donors and partners. So we really to hear this real stories from the real people, and you should speak to them through emotion. When you show your real emotions, you'll get the trust from them, and the trust motivates your partners. So you have to, first of all, to acknowledge that they are all with you. I mean, the partners. You should really, let's say, acknowledge their shoulder, their support, and to appreciate this. And again, when, for example, you develop some project, so the partners should involve also the opinion of, for example, of the doctors in all the projects, and the partnerships should be achievable, I mean, feasible. And again, better to seek partners for, let's say, with a long-term story, as Yevgen mentioned. Since the very beginning of the war, we got lots of proposals for help. So people were bringing everything possible. We even got the stories that, for example, people brought the medicaments, but the medicaments were at the let's say at the edge of the term of use, and I got to let's say to screen out all of this, and then when your partners they understand what is really needing, and so such partners really got trust and they give result, and these are the long-term partnership. For example, I would like to tell you about the ultrasonic sensors. For example, first we developed an application for a grant. Sure, with that you should add your own story, and it's very important. For example, in case we have a family doctor in the village for whom it is logistically hard to get to the village. And again, when we explained all of this, when we developed an application for a grant, we presented the past, the let's say the present and the future, how it will be, and yes, such application will be supported. And this, first of all, about the understanding, about the integrity, about the esteem and trust.
Thank you very much. In order to get the attention of the partners, international partners, domestic partners, we need to demonstrate that we do exist. If we are not visible, no problem, the ambulance is running, people may think that it runs by itself. On every first to write 2 posts per week. No, tak. With assisted and during the delivery, for example, successful reanimation, successful reanimation, just post in the media. Visibility, and secondly, we're not like Bangladesh and international partners when they provide the syringes with expiry date. No, we're not gonna. So Facebook post, it should be law instituted that celebrities from emergency demonstrate the visibility, the scope of assistance to us and what we can do thanks to this assistance. And we managed to start we're highly technological, but with problems. This should be known. At United 24, Andriy Shevchenko played. He is not a great speaker, but he's a legend, and he can get money, and he can buy ambulances, which he gives to us. So we need people like this, thanks to visibility. Writers from Germany contacted us. We exchanged the letters for half a year. We desperately needed oxygen stations. So maybe you need this or that. So we were looking for in communication a joint emanator, and in Kryvyi Rih we have oxygen station. We're not buying oxygen, paying a lot of money. We have our own oxygen stations. We can, when we're not asking money, but we have cooperation with, don't pay, but let's accumulate the money, and then we'll be able to buy some warm clothes. So hope clothes. Probably you saw my driver in a great jacket. That's a really cool jacket. I would like to appeal again to Mr. Syczynski, who made great statements, and that was really touchy. He hit the point. We speak about how to engage more funding, more resources to non-social society, how to increase the trust the population inside the country, outside. The shadowing. We know nothing about you. This is us who cooperate with, but what society knows about the operations of the fund, what's the budget, where it comes from. We as managers, should we share our analysis? Yeah, we are very transparent, but the same case should be with the shadowing. I don't want to talk about the organization. Maybe it works and the proper reporting for the society, but as micro partnership, against people who are not always, whose hands are not always clean, who are not very open. And it happens that from that, on the website, The doctors make presentations on TV and media. We want to be visible and to demonstrate how important we are in the Chernihiv region, specifically, but to talk to any donor or in the civil society organization about their potential support. We have a list of objects, list of what we have on the wish list. That it was minimum through the multi-million project, but I think in that case we should courage of men. That's open for us more. This is a courage. I want to compliment that indeed. In order to for love to exist from two sides, you need to meet. Have to meet, have to go on site to talk to the patient, to talk to the management. It should not be a day or two to know about all the. I will invite everyone to the village of Sibley, Ukrainian Center veterans. Have a nice place, easy to get in, difficult to get out. Yeah, it's true. For partnership, under previous management, the non-partners allocated 1 million euros for the reconstruction of 2 floors. From our side, it was a long-lasting partnership. And we were not able to implement everything because of the Ukrainian legislation, because of the tender procedures. So we found a solution. We asked 10 million greeners and decided to use them for the procurement of the equipment. To fix the issue of digitalization. And now every month I report to them. It's not a quick process, again, tender procedure, but they saw that we are interested to cooperate with them in a fair manner. And they mentioned that if you need 1 more million, this is mutual love, and it would be great. Thank you, Evgenia. I would like to thank you for such a conscious discussion, for a fair answer, for sharing practical cases. I'm sure that the guests who are here with us got lots of information, one which can be used in their institution in real life and practice. Thank you. I never mentioned that before, but the patient who is under shock, you need to do the adrenaline injection, which costs not that much. But if we don't do that emergency interference, now my speech is rather emotional, but kind of a feedback. I would like to thank those who helped our hospital when we were sort of on the island. We have a unique experience working in the island, Ukraine. Our island existed 10 months, and Sumy were surrounded. No communications from a big territory. You had no opportunity to restore the inventory. I would like to thank Halina Solovey Sorry, this is very emotional. On March date, together with Halina, we delivered 5-ton truck of the solutions. We hired this driver, and Halina father's was able to go to the surrounded city. And it really rescued our life. And please thank you for your resilience. Can we have the portal or the portal with our wish list? If you, maybe something as a wish list. So, it was mentioned at the beginning of the discussion. If we can develop practical, so let's create a task force for the future conference next year. We'll get out from here with some specific outcome, specific goal, at least on the flip charts, and you'll continue your advocacy campaign. I don't say communication director, but let's talk about the website later. Thank you.
There were comments, some comments to your discussion, but again, I would like to ask you to make a round of applause to your panelists and Daria. Daria still wants to comment. So I can't keep silence since I want to say that the system that unites public and private facilities, say it's a system exists. Say we can get the request from the facilities and we hand them over to the humanitarian organizations. This partnership exists, and so please just use it. As a member from the concerned group of this cluster, of the health care cluster, that embraces over 140 organizations, humanitarian organizations, to provide the assistance to a facility. We use this platform actively, and we see the requests from the hospital. So again, you should really master this automated data. This is 5W platform for the healthcare cluster. Well, I think such requests can appear. I want to say that we will just send a link to this platform to every member, to every participant of the conference. And you'll see how the requests are collected and processed. Over there is a part of Ukrainian organizations. Mainly these are international humanitarian organizations. So we will share this information with you, colleagues. We finish almost in time. So we approach to a final phase of our conference, and again, let's congratulate ourselves with that we will be such warriors as Andriy Zelinsky described. So why? Because you save lives of people. You make impossible possible. And so we have to show to the whole world that our strength is that we can stand up when we fall down, and we can do it every time we have to fall down or someone pushes us down. We can still stand up and fight. Yes, there will be storms, yet more storms, but first of all, we have to visualize how we overcome the storms. And first of all, I would like to thank for the incredible event that was organized РАЗОМ for Ukraine, for their support. And they made it possible for us and for you. And please applause to our team of partners. Thank you. And I also would like to thank everyone being present here, being involved, be asking those who are asking questions and those who stay with us. And we got such persons together with us, able to discuss everything, even some painful and acute questions, but these questions still have to be discussed. Thank you very much for your time. So we organized a whole Maidan, a whole platform where we united all of us, all of our partners, and our healthcare cluster really is strong and has its own voice. Thank you very much. Well, what I want to say, thank you very much for being with us. First of all, it's really nice place. We have been here. That's really a good spa, a good place in the nature. And I would like to call on you. But first of all, I would like to tell you about my volunteer who was pregnant, who was really hard time, losing trust and really facing people who were in the boxes or in the stay in their boxes. But again, saying everything was built right. Yes, sometimes we lose our senses, but again, please stay strong, find support in others. So I wish you all your supporting parts to be always with you and to be protected, to feel strong, to feel trust, sense, and to believe in yourself, since a person without a belief will really quickly fall down. Thank you very much to be with us. Thank you very much to trust us, to believe, to act, to voice all the challenges. Thank you very much. Colleagues, now I would like the two teams organizers, please stand up, and we would like to make you a round of applause. I really appreciate you.
Дякуємо технічній команді і команді підтримки наших перекладачів за те, що ви були з нами.
We are quite thankful to our organizers, to our technical team, to our interpreters, and to do all this magic in the very difficult time. Please thank our colleagues. Thank you very much. Dear colleagues, as of today, our event is closed, but let me remind you, we'll get the transfer at 4 p.m. This is all for today. Thank you very much, and I wish you peaceful days.